everyone. Thanks for joining us today. My name is Christina Di Bartolo. I'm a clinical assistant professor here in the Department of Child and Adolescent Psychiatry at NYU Langone Medical Center. I work with children and families on a variety of issues, but I do specialize in attention deficit hyperactivity disorder and other disruptive behavior disorders. So we're going to get started. In case this is your first time joining us for one of our webinars, I just want you to know that you can submit questions at any time today by typing them into the questions pane of your control panel there. That's on the right side of your screen. We're going to answer questions at the end of the presentation. So thank you for joining me. This talk is called Using Information to Better Advocate for Your Child. So first things first, I think all of our English teachers would want us to start with a definition. What is an advocate? There's, of course, a couple of different options here. I'm going to walk you through them because we're going to mainly focus on one type today. The first definition is really one that a lot of people think of when they hear the word, and that means almost literally like a lawyer, someone to stand up in the court of law representing someone who either can represent themselves or would be better off with someone representing them. The next definition is someone who stands up for a particular cause or a particular proposal, something that's important to them or important to people near them, and they decide to stand up for that cause. The third one is really the definition that we're going to be focusing on today. This is about someone supporting or promoting the interests of another person. So why does this come up so much with parents and kids? As you know, the law doesn't give kids the same legal protections as it does adults. Before someone turns 18 years old, they are limited in the things that they can do. That means that it's important that someone is there to represent them in those cases where they're not able to represent themselves. Now, there can be a number of different people who advocate for a child, but the most common person who tends to be the child's first advocate is his or her parents. Now, before we get into the talk, I do want to clarify what advocacy actually is. There's two components to it. We're going to focus on advocacy specifically and not something else, which I'm going to get to in a second. Advocacy seeks first to reduce harm. So the goal of advocating for your child is because you're looking to reduce any possible harm that could be either currently happening to your child or could reasonably happen in the future. So that's one of the goals of advocacy. The other is to ensure equal access. So advocacy is important if you find that your child isn't having equal access to other opportunities like their peers are. So that would be another case where it's really important for parents to be thinking about advocacy and how they're going to step up for their child. So I mentioned that advocacy is not something else. So let's talk about what we're not really going to be covering in this talk, which is general sort of consumerism, the idea that, of course, we want the best for our kids. We want everything for our kids. What our kids want, we want to be able to give them. So that seems like it should be advocacy, right? Your child wants to go to a particular college, and you really want them to go there too. And so if you go ahead and help them with their applications, that's advocating for your child. In the context of this talk, we're going to say that's not actually advocacy. There, you're not seeking to reduce harm. You're not really looking to make sure your child is getting equal access. It's more about being a consumer in a world with different options. So just as we take a look at this slide here, the Rolling Stones probably said it best, that you can't always get what you want, but if you try sometimes, you might find that you get what you need. And that's what we're going to be focusing on today. Now, the first thing for advocating for your child that's going to be important is choosing specifically what you're advocating for. This is going to make your argument much stronger. We could start with some specific interventions. Let's say on the school level, you're looking for some 504 accommodations for your child. You're aware that your child isn't focusing, they're having trouble listening to the teacher, but if you're able to ask for a specific accommodation, like sitting in the front of the room, then that request is more likely to be granted. You might actually want an individualized education program for your child, an IEP. This is something that has a legal backing to it, so it has to be enforced if a child has an IEP. This is a really nice option for individualizing the educational experience for your child. In general, we know, especially if your child attends a public school, that education kind of looks the same for all kids. This is your chance to customize education so it's best for your child's needs. You might be looking for behavior therapy for your child. You might find that individual therapy for your child is what the services that you're looking for. Now, sometimes parents don't always know exactly what the intervention is that they're looking for, and that's totally okay. That doesn't mean that you can't advocate for your child. In this case, what you want to do is be thinking about a consultation, a second opinion, maybe additional testing to further understand what your child's needs are, so that then you can decide on an appropriate intervention that you would be asking for subsequent to that. The last piece I put on here is support. This is really important for parents, particularly if you're a parent of a child who does have some special needs. You're doing a lot for your child already. You're probably involved in a number of different systems, different caretakers, possibly physicians. You might have a lot of meetings with the schools. There's a lot that's going on there, and it's a pretty big role. So some parents might seek out parent therapy for themselves or support groups. They might look for some respite care. So this is a way of supporting your child by making sure that you're getting the downtime and the extra support that you need. And lastly is you might want to actually find what we call a parent advocate. This is someone who can help you argue on behalf of your child. So if there's information that you don't know or you don't feel comfortable speaking with someone, a parent advocate can step up and help you in those situations. And that's not an option that parents necessarily know is available to them. So you've decided the intervention that you want to be advocating for. Now you really want to gather some information. Is there a precedent for this type of request being granted? So is this the kind of thing that people have asked for before? Is your request reasonable and or evidence-based? So reasonable obviously is in the eye of the beholder, but you want to think about, is this something that could feasibly be done? And or evidence-based, meaning is there research to support it? Not just a Google search of people saying, yeah, this really worked for my kid, but doing an actual search or speaking with your child's clinician to say, you know, has there been research studies done, high quality research studies, maybe over a good length of time, that really show that this intervention I'm asking for is helpful in achieving the aims and outcomes that I want for my child. You also want to think about what are some of the barriers that you're going to encounter. For example, maybe your child attends a very small neighborhood school. Maybe they only have one class per grade. If you'd like to enroll your child in a class that includes integrated collaborative team teaching, and there's only one class and it's just a regular ed class, then we have to figure out, okay, how are you going to be able to get that for your child given the constraints of where your child currently goes to school? Now, before meeting with whoever it is you're going to be speaking with on behalf of your child, you want to understand who your audience is. First of all, big picture, do they have a legal obligation to you? There are some people who do. If your child attends a public school, there are certain legal obligations that the school does have to follow, particularly under the Individuals with Disabilities Education Act. They might not have a legal obligation to you. Let's say you pay some money for your child to go to a private school. They might not have a legal obligation to you other than just to provide the educational service that they put forth when you first had your child apply to that program. Duration of relationship is also really important in the way you're going to go about advocating. Is this just sort of a one-off request? You're never going to see this person again? Or is your child going to possibly be interacting with this individual for the rest of the year? Are you planning on keeping this, let's say, treatment provider for a number of years? That's going to change the way you approach the situation. You also want to think about what your audience brings to the table. What kind of access do they have, whether to the right people or resources? What kind of experience can they bring to the table? They probably have some knowledge that can help you as well. So you want to know that before you go in so you understand a little bit more about who you're speaking to. We're going to get into some specific situations about that in just a minute. Now, the other thing to think about is really seeing the entire picture. When it's your child who has a need, it's very easy to sort of focus on that microcosm world of what my child needs and what is happening. But probably whoever you're about to ask for a service is thinking much more big picture. They're thinking of many kids, possibly they're thinking about laws and regulations. And that's where parents start to struggle with some red tape. So the first thing you want to be aware of is any governmental agencies like the Department of Education who might be overseeing and otherwise restricting the options that are provided to you. There might also be some licensing bodies to keep in mind, like medications. You know, doctors are restricted as to the certain things that they can provide because they need to keep their license and they have to follow those regulations. There's also different entities involved with the medical system, like reimbursement, there's confidentiality. You might really want for there to be a daily check-in between your child's behavior therapist and their teacher, and that's great, but someone's going to have to sign a HIPAA authorization form first for that to be able to happen. And do you know how they're going to be able to communicate in ways that also follow those regulations? You can't probably just be sending text to each other. The other thing to keep in mind is there are regulatory entities that you might not even know about. I put the Institutional Review Board here because I do work on research studies. Research studies are a great way for families to get possibly a free evaluation, possibly even free treatment for their child. But the people who come up with the research studies have to follow a set of criteria that have been approved by the Institutional Review Board, and they can't deviate from that at all. So let's say you find a perfect research study. It's for kids who are on the autism spectrum, and it's going to help them with receptive language, and you're so excited to sign your child up, and they say, I'm sorry, the study only goes down to 6-year-olds. And you say, well, he's 5.5, he's very mature. They really can't do anything there for you. Their hands are tied, and so are yours. And this is set up for the protection of human subjects. So while it feels like people are just saying no or being difficult, there's usually some rationale behind it. And if you can try to stay calm and ask some good questions, you can figure out why it is you're coming up against that red tape. Now, I put a book here called Getting to Yes. I don't receive royalties from this book. I have nothing to do with this book professionally, but it is one of the most popular negotiating books that's out there. Getting to Yes talks about the best alternative to a negotiated agreement, or BATNA. It means what's going to happen if you can't actually come to an agreement with a person that you're working with. Sort of what's the default? What is going to happen anyway? And that's going to help you when you go into an agreement, because if the BATNA is something that is not great but not terrible, that's going to influence how you're advocating. If the BATNA is something completely untenable, unacceptable, that cannot continue, then you're going to need to try a little bit harder to come to some kind of agreement with the person that you're working with. And before you sit down, with the person, you're probably going to want to prepare a little bit. So practice quite a bit. One of the reasons is because if you're thinking about your child, this can get pretty emotional pretty quickly. If you practice what it is that you're planning on saying, you have a chance to emotionally distance yourself just enough that you can make sure that you're really articulate and you say what it is that's important to be said in the meeting. You can also run it by a trusted friend, family member, or professional. Someone that you trust to give you the truth, of course, to say, you seem a little angry here, or you're actually not being firm enough here, or you're skirting around the issue. I didn't know when you said that that's what you really meant, and you just be a little more clear, and they'll help you out to really hone your message. You could also record it and watch it back, particularly looking for, any kind of mannerisms that you engage in without realizing that could be distracting to your audience. Now, some general strategies before we get into specifics is that we want to think about the difference between firm versus aggressive. Some parents really feel uncomfortable with confrontation because they're concerned that they're going to be seen as aggressive. Aggression is something very specific. I doubt that you're going to be aggressive in a meeting. As long as you use respectful language, you should be able to say whatever you feel as firmly as you need to get that point across. The second is living in the world of should. So, of course, it's incredibly frustrating if your child is owed a service and they're being denied that service. It's a really hard thing to deal with. Parents quickly start to use language like, my child should have this, your school should be providing that. But unfortunately, that really gets in the way of the reality, which is where we live. So while it should not be that way, if it is that way, you want to focus on a solution that's going to get you to the answer. The last one is, when possible, assume neutral intent. So this is tied up with why people feel like it can get aggressive, is that you feel like the person on the other side of the table is sort of against you in some way, as if they don't have your child's best interest at heart. This is a good time to think about the difference between interest versus position. So your interest is for your child to succeed. Generally speaking, a lot of the people who go into education or healthcare or working with kids have the same interest. They want kids to succeed. So usually your interests are aligned. What is a little bit different at times is the position you take on how to achieve that interest. So your position on the interest of how to help your child succeed might be that your child can use assistive technology. They can use a laptop in the classroom when other kids aren't allowed to use a laptop. Now, the school staff might say no to the laptop, no to your position, and you might think they don't have my child's best interest at heart, when really they might have some other position. Maybe they've read research on it showing that laptops aren't helpful, or maybe they know that it's actually more distracting to the child using the laptop than helpful. But you have to figure out what that is to figure out why their position is different than yours. And you want to really focus on coming to an agreement that meets the interests, and don't worry so much about what the specific position is. Now, I promised we'd get to some specific strategies. I'm going to take you through some that I have seen. We have broken down sort of by audience, and the first one is sort of the first point of contact for many parents, which is classroom teachers. Now, there's a couple of things that happen with classroom teachers. The first point is they usually teach multiple students. Unless this is an individual tutor, even in very small classes, teachers have a number of students to be thinking about. So the first step here is want to really try to empathize with just how busy they are. It really is quite exhausting. If any of you are teachers or have ever run a daycare or just in general have had to supervise a group of kids for a period of time at, say, a birthday party, you know just how tiring it can be. So not to say that's an excuse, but to just keep that in mind first and foremost. The next is that classroom teachers often don't make decisions necessarily. On the day-to-day, you know, they can have some latitude, but overall, in terms of big policy issues, they don't have much of a say. So what you might want to do with classroom teachers is consider sort of enlisting them to be your support, where they can provide their feedback on your child and observations, and then that way you can take that feedback and those observations if it turns out that you need to actually meet with the principal or another administrator to try to advocate for what your child needs. So in this way, you've sort of enlisted the classroom teacher without further burdening them or taking on anything, any of their time or what they need to do. Next is the principals. So also being mindful, they may or may not be in charge of certain decisions. I wish I could be more specific about this, but it is going to vary from school district to school district. For example, in New York City Department of Education, the principals do have a fair amount of latitude with how they run their schools, especially around purchasing decisions, for example. But that's not necessarily true in all school districts around the country, and I'm hoping we have some people that are maybe not local listening in, so I don't want to say something that's not applicable to your situation. So you do want to start to find out and clarify how decisions are made at that school. How much latitude does the principal have versus the administrator? Evaluators and testers. So this is maybe a school psychologist or other people who are doing testing for your child. You want to be mindful that they do have to report their findings as they occur. So there's no such thing as afterwards sort of smudging the numbers or changing things a little bit, even if it means your child's application to a school, you know, might be a little bit weaker for the finding. They can't change what it is that they found. However, you can try asking them if they would like any subjective information from you or another collateral source of information, like another parent, maybe a teacher, that can help put their results into a broader context and really start to send more of the message that you feel is appropriate to best kind of define what's going on with your child. Insurance companies, these guys are tough. You know, they have to follow a lot of different regulations. There's legal regulations, there's their own business regulations. So this can be really tricky. I would say, particularly in this area, instead of trying to pick a position, a thing that you want, let's say a specific service that you want covered at a specific rate and going for that, try to be open and see what they've done for families in the past that have worked. So try using language like, so when you've seen other families in my situation, what did you recommend? And try to see what kind of solutions they can give you. This is going to cut down a lot of wasted time and a lot of frustration on putting forward ideas that they are never going to be able to approve or do for you anyway. The last one I have here is other parents. So here's the thing, other parents, of course, are going to see their own child's interest as the #1 priority here. And that's normal and natural. We don't want to fault other parents for that. They're doing what they should be doing. So if you see that there's a situation going on with your child, let's say in after school or at the playground, something along those lines where they're getting involved with another kid in a way that's making things a little bit uncomfortable and you have to approach another parent, you want to think about how you can align their goals for their child with your goals for your child. And don't, again, necessarily assume ill intent. So if they're, you know, letting their child call your child a name. You want to sort of find out, hey, I noticed you let Jeremy use some language that we actually don't use in our house. Can you tell me a little bit about that? I'm interested. And find out what's going on there. They might have a reason for the decisions that they're making. So if you're legally wronged, you might really want to seek representation. For the New York City area, I put Advocates for Children, which is an organization that works with families who do need to get involved in the legal system, typically around educational access. They either provide lawyers or show families how it is they can obtain their own lawyers, but there are going to be options like this in your community wherever you live. Especially once the law gets involved, it really is important to bring someone onto your team who understands the legal issues. Now, back to that idea of sort of getting what you want. Sometimes you might really just be a consumer, so it's not a legal issue necessarily. There isn't a legal right that's being infringed upon, but you know, you're paying for a service and you're expecting a certain outcome for your child. Here's some options for you. You might have to ask a few times, maybe many times, and maybe to different people, but it could be that the overall entity is willing to give you what you want, just not the first or second person you spoke with. This is another time to really assume neutral intent. If it's the fourth person you're speaking out with, they might actually not have been involved in any of the previous conversations. So you're starting to get frustrated, you've had this conversation 3 times and now it's the 4th, but remember it's their first time coming to the situation, so you want to try to keep that in mind. Similar to with other parents, you want to look for mutual goals. So the idea is to think about how you can be a we. In this picture, we have our 2 parties are sitting on the same side of the table. They're looking at the situation together. They have different roles and responsibilities, but they're thinking about how they can both achieve the same end. Also, last, just sort of be the person they like speaking with. Be the person that when they see it's you by your phone number on their phone, they go, oh, okay, and they pick up the phone. Because if you're a consumer, you don't have a lot of recourse after this. It's sort of whether or not they're interested in giving you that particular service. So just kind of a reminder, you might not have laws to back you up in consumer situations. But paying money does not mean always getting exactly what you want. We've all had this situation, and it is frustrating, but it's true that consumerism is not the same thing as advocacy, and so keeping that in mind is going to be important. The last situation is if you're just completely dependent. You're not even a consumer necessarily. You're just sort of in a situation and you're hoping to get a certain outcome for your child. You do want to manage your expectations. It's definitely worth, speaking up to someone, let's say that example, the parent on the playground. If you feel like something's going on that could be causing your child harm or, again, sort of reducing their access to a situation, you can try speaking up, but know that that other parent has the same exact right as you have to be there. You might not achieve the outcome that you want. Of course, if possible, try honey versus vinegar. Again, you can be firm, but still be polite and considerate and respectful. I would put all of those in the honey category, absolutely. So we do want to see if there are any questions that we can take from the audience. So I'm going to take a look. It seems like the first one here is, how does one locate an affordable parent advocate? Nice question. The first thing, if possible, is actually to start at your school. There's likely a parent coordinator or parent representative. This is someone who is not employed by the Department of Education. They are another parent just like you. They've been involved in the inner workings of the system somehow. So their child might not have the same situation as your child, but they understand the system a little bit more and can help you out. If they feel like they can't help you, they have the network there to sort of say, okay, here are some parents in other schools or other locations where they might be able to assist. The other thing to keep in mind is that even if you don't have someone like a parent coordinator who is, particularly savvy, experienced, and knowledgeable, you can also pull advocates from other sources as well. Oh, and quickly, that said affordable. Parent coordinators at schools should not be charging for this service. It's like something that is offered, so keeping that in mind. Just saying though, if you don't have a parent coordinator at your school or you're not comfortable with the parent coordinator at your school, keep in mind that parent advocates can often be, frankly, anyone. So it's national law that if you have an IEP meeting, you can bring whoever you want to that meeting. So if your sister is the person who calms your nerves and helps you say what it is you need to say, your sister is allowed at your child's IEP meeting. If there's a therapist who's been working with your child for a while and knows them very well, the therapist can be at the IEP meeting in person, or they can phone in if they can't leave their office when the meeting is being held. So So just know that you can enlist a lot of different people to help you advocate on behalf of your child. With regard to specific legal representation, affordable is definitely going to be tricky. Like most things, we have a situation where the very wealthy can afford to pay lawyers' fees. Lawyers' fees tend to be pretty high because they went to graduate school, they paid a lot of money for that, they didn't probably have a job for those 3 years, and so they then charge some pretty decent rates when they get out of law school for their services. So wealthy families tend to be able to figure out a way to do this. Families who are really struggling financially can avail themselves of different options. For example, like Advocates for Children, which I pointed out, they'll look at families on a case-by-case basis and see if there's a need. They can actually provide that representation to the family without the family having to pay out of pocket either at all or a sliding scale fee. Like most things, it's the families that are sort of in the middle who get the rawest deal about this, and it's going to be much more challenging to find someone that is a good option for you. I would think about what are the issues that are legal specifically and try to get representation only for those issues, and everything else try to manage separately. That would be my advice there. Let's see if we have a second question. This one says, can you recommend any resources for parents to use to research different accommodation options within schools? This is a fantastic question. The first thing that you want to do is know in general what different options are nationally, and then from there dive further to see does your child's neighborhood school offer those options. So nationally, the quickest way to go about it is literally to Google IDEA, Individuals with Disabilities Education Act, and what this law says is that all children should have free access to a school to be educated in the least restrictive environment. So free is embedded in there. Least restrictive means that the law has to try to accommodate the child in a way that is least restrictive first. So it's not that if your child is having a little bit of trouble, then immediately they have to go to a completely different school. It's, can we educate the child in their current classroom, but by tweaking the settings, or not the current classroom, but at different classes in the school where there's maybe more teacher support. And then there's a number of different gradations there that you can look at and seeing kind of generally where you think your child would fall. Again, sort of starting with least restrictive. And the last key piece of this law is appropriate. So it should be an appropriate setting for your child. The first determination of that, of course, is the parent. Does this seem like it would be a good setting for my child? A 12 to 1 to 1, so there's 12 kids in the classroom, there's one teacher, there's another trained staff professional in the room there, 12 to 1 to 1. If that seems appropriate for you, that can be the first thing that you advocate for, but it is also going to be a determination of the IEP team altogether if the school also feels that that's appropriate. If you don't agree, you can always continue to repeal. You never have to sign an IEP that you don't agree is appropriate for your child. To this question though, what if the school doesn't offer what it is that you and the school think are most appropriate for your child? In that case, the school is going to have to take on the burden financially of getting your child in a school that can provide those options. From there, it gets into legal territory. So the idea is the school will probably have an alternative option for you. When you speak with them, they'll say, we don't do that, but this school here offers it. We pay for busing, and that's where your child will go. If that doesn't work for you for some reason, that's when we really start to get into mediation and further things to try to figure out really what it is that you think would be the best spot for your child. But the key thing here is to start with overall what's available so that at the IEP meeting you know that you're asking for something that actually exists under the law, and then being open to hear from the school about what it is that they can provide. Your school's going to have a guidance counselor, a social worker, a school psychologist, someone who's been involved in IEP meetings and is going to have the rundown of what it is that the school can provide. Honestly, I recommend just speaking with the person you feel most comfortable with, because that way if they don't know the answer, they'll find out and get back to you. So it's not always necessarily asking the right person, it's asking the person that you feel comfortable asking to get the ball rolling. This question is, can a person from school-based support team help us find advocates? You can certainly ask. I don't actually know if they have a legal obligation to help you with that, but you can definitely ask. Again, this kind of goes along with what I was just saying about who you feel most comfortable with. So let's say there's someone on your child's school-based support team who has been working with your child for a while, or you feel really comfortable with them, and you think that some some things could be changed, it's okay to approach them and see if they have any suggestions. But I actually don't know the answer whether or not they have a legal obligation to help you do that. This one says, any specific recommendations in regards to services for high school students at senior year? Ooh, I'm glad you brought up senior year. So here's the thing. The Individuals with Disabilities Education Act can follow kids all the way through college if they want to continue to use the services in college. So if you are a bit concerned that your child's going to have trouble in college with note-taking, you might want to consider starting up this idea of having a scribe for your child or somehow getting the notes otherwise sent to them, because that way when they get to college, they can go to their Office of Disabilities and actually get that service. So that someone else in the class who takes notes and in the same class doesn't know who's getting them, but they'll submit their notes and then your child can get a copy of those notes. That's just an example, but yeah, if you think that there's services that would be beneficial to your child in college, you do want to take a look at them in high school as well. Another thing too is you're starting to show your child now, well, basically young adult, that there's no stigma to getting what you need. It's about customizing the educational experience. There's so many things in life that we don't get to customize. We just have to deal with it as it is. This is an opportunity for your student to, look at the situation and say, wow, what would be really helpful here? Get it set up in high school. That way they can take it with them in college as well. Now for our last question, what if the specialist recommended a small class size and the district doesn't agree, nor does it offer small class sizes, just co-teach classes? Meaning, do you have to settle for the co-teaching class? If you meant, do you just have to sort of settle for the co-teaching class? No, you don't. Again, you don't have to agree to anything that you don't think is appropriate. If you think that co-teaching isn't going to work because with all those kids in the class, it's still just too distracting anyway, so it doesn't really matter that there's 2 teachers if there's still about 30 kids, then you don't have to sign that IEP, but it is going to be a process to move forward to try to find out how you can get the school to pay, which they are legally obligated to do, if that is determined to be the appropriate setting, for your child to be in a small class size, because it sounds like it can't actually be offered at that school. So that's going to be a tricky situation. This is the kind of thing that parents, discuss. It sounds like you have someone on board with you, a specialist, to discuss this and say, what is this going to look like? Find out, how long does it normally take for this process? It can be a while until your child is in the educational setting that you feel is most appropriate for them. So best of luck going through this process. I'm glad that you have someone in your corner already to get started. So that was our last question. Thanks for joining us today. On behalf of the Child Study Center, we really appreciate it. Once you leave the webinar, you're going to get a survey, and we would really love it if you could complete that. You'll also receive a follow-up email within about a day or two that has a link to today's recording of the presentation. We hope that you can join us for our next webinar, which is going to be Dating and Sexuality for Young Adults with Autism Spectrum Disorder with Liz Roberts, who's a PsyD, and that's on Tuesday, November 29th at 1 p.m. Thanks again. Bye.